Did you know some medications can cause or worsen diabetes? It's a little known fact that can significantly impact the lives of those grappling with this health condition. Today, we're diving headfirst into this crucial topic, unpacking how and why certain medications can either cause or exacerbate diabetes. This understanding is not just essential, it's a game changer for effectively managing the condition. Whether you're curious, concerned, or just committed to better health, this video is for you. We're all about fostering a community of knowledge here. So don't forget to hit that subscribe button and drop a comment below that you subscribe. We'd love to hear from you, and I'll personally try to respond to every comment. So grab your notepads and get comfortable, because we're about to dive into a sea of indispensable information. Stay tuned as we delve into this critical topic. First up, we have corticosteroids. These are a type of medication that's often used to treat various inflammatory conditions, a powerful tool in the medical world. But it's important to know that they can also play a role in causing or worsening diabetes. You might ask, well, prolonged use of corticosteroids can actually lead to the development of type 2 diabetes. This is because they can increase your blood sugar levels over time. And if this elevation is sustained, result in diabetes, and that's not all. You're already diabetic and you're taking steroids. There's another factor to consider. You may require insulin during treatment to help keep your blood sugar levels in check, because corticosteroids can make it harder for your body to use its own insulin effectively. Remember, if you're diabetic and taking steroids, you may require insulin during treatment. Next, let's explore beta blockers. These are drugs often prescribed for heart health. They help reduce blood pressure, slow down your heart rate, and lessen the heart's demand for oxygen. Now, here's the catch. Beta blockers can impair insulin sensitivity. This means your body's ability to respond to insulin, the hormone that regulates blood sugar levels, can be affected. This in turn can increase your risk of developing type 2 diabetes. Essentially, while your heart might be beating more commonly, your blood sugar could be having a bit of a party. It's a complex balancing act, isn't it? So if you're on beta blockers, it's essential to keep a close eye on your insulin levels. Regular monitoring and discussions with your healthcare provider can help manage this risk effectively. Remember, knowledge is power when it comes to managing your health. Always be aware of your insulin levels when on beta blockers. Now on to thiazide diuretics. These medications are frequently used to help manage high blood pressure and reduce excess water in the body. But here's something you might not know, bioside. Diuretics can actually elevate your blood sugar levels. They can also lead to a reduction in essential electrolytes, which are vital for many bodily functions. How does this relate to diabetes? Well, higher blood sugar levels can contribute to the development or worsening of diabetes. Reduction in the central electrolytes can affect your body's ability to function optimally, which could indirectly impact your diabetes management. Now, this doesn't mean you should immediately stop taking your thiazide diuretics if you have diabetes, but it does mean that it's essential to monitor your blood sugar levels closely. If you're on these medications, in some cases, stopping these medications may actually help to normalize your blood sugar levels, but keep a close eye on your blood sugar levels. On thiazide diuretics, your health could depend on it. Let's talk about statins. Statins are a class of drugs that doctors prescribe to help lower cholesterol levels in the blood. Lowering the levels, they help prevent heart attacks and stroke. But there's a caveat. Studies have shown that individuals taking higher doses of statins may have a higher risk of developing type 2 diabetes. Yes, you heard it right. Your medicine for managing cholesterol could potentially tip the scales towards diabetes. The Food and Drug Administration, or FDA, has even issued warnings about this possible impact on blood glucose levels. So if you're on high doses of statins, it's not just your cholesterol you need to keep in. Eye on your blood sugar levels should be on your radar. To regular monitoring can help detect any potential shifts in your glucose levels, allowing for early intervention. Remember, when it comes to statins, knowledge, vigilance, and regular checkups are your best allies. Moving on, we have antipsychotics. These medications are critical in managing various mental health conditions, from schizophrenia to bipolar disorder and even severe depression. However, they do come with certain considerations, particularly for those who have diabetes or are at risk of developing it. Like many medications, antipsychotics can have side effects, and one of them is weight gain. This can be a significant concern as weight gain is a risk factor for type 2 diabetes. Additionally, these medications can also lead to elevated blood sugar levels. Over time, this can create a perfect storm for the onset or worsening of diabetes. Perhaps more concerning is the fact that prolonged use of some antipsychotics can result in permanent diabetes. This is a serious consideration and one that should be discussed with your healthcare provider if you're on these medications. Remember, mental health is vital, but so is managing your diabetes. Lastly, we'll discuss birth control pills. These pills are a common method of preventing pregnancy, but did you know they can also affect your blood sugar levels? Yes, they can. Indeed, birth control pills can make you more insulin resistant. It means your body may struggle to use the insulin it produces effectively, leading to higher blood sugar levels. This doesn't mean that taking birth control pills will cause diabetes. However, if you already have diabetes, whether it's type 1 or type 2, it's important to be aware of this potential impact for diabetics. Blood sugar levels may rise after starting birth control. If you're diabetic and considering birth control pills, it's essential to monitor your blood sugar levels closely and discuss this with your healthcare provider. Keep this in mind if you're diabetic and considering birth control pills. Understanding the impact of these medications on diabetes is vital. We've journeyed through a variety of medications from corticosteroids to birth control pills and understood how they can influence diabetes. We've seen how corticosteroids and beta blockers can lead to the development of type 2 diabetes, while thiazide diuretics can elevate blood sugar levels. Statins used for managing high cholesterol have also been associated with a higher risk of type 2 diabetes. Meanwhile, antipsychotics can lead to weight gain and elevated blood sugar levels, and birth control pills may make you more insulin resistant. It's essential to remember that managing your health effectively requires awareness and action. If you're taking any of these medications or are concerned about diabetes, don't hesitate to consult your healthcare provider to guide you through the best course of action tailored to your unique needs and circumstances. For more information or questions, feel free to reach out. Stay healthy, and I'll see you in the next video.